taking care of the slides. So hi, everyone. I'm Gillian Shapiro. I'm the New Hampshire Cancer Partnership Manager. So I'm embedded within the Dartmouth Cancer Center, but my role and position is actually under the New Hampshire DHHS Comprehensive Cancer Control Program. So next slide. So here is the agenda, an overview of what we will cover. So the coalition is called the New Hampshire Cancer Partnership, and I will give you an overview of what that is, what that means, what the purpose is. We'll look at the data and how that informs our work. We'll talk about health equity and the importance of equity in all that we do. I'll share with you our tentative organizational structure. Since we're just getting started, a lot of this is tentative, and we're just building up to revitalize our coalition. I'll also share some interested organizations and partners that have already committed to being part of the partnership. So if I say partnership or New Hampshire Cancer Partnership or NHCP, they all mean the Cancer Coalition. So just to back up for a second, because I use them all pretty interchangeably. So next on the agenda, we'll talk about the New Hampshire Cancer Plan, which is a work in progress right now. We're going to invite folks who are members of the Cancer Partnership to weigh in on priorities, and we'll start building it out. But there is something there that directly involves CHWs, so I wanted to share that with all of you. And of course, we are seeking partners and recruiting for all of our committees and work groups. So next slide. So just to level set, what is a cancer coalition? All 50 states plus DC plus 8 US territories and 7 tribes or tribal organizations have similarly funded cancer coalitions. So the New Hampshire Cancer Partnership is a CDC funded program. It looks at the burden of cancer in New Hampshire or whatever region. We're in particular talking about New Hampshire here. We implement strategies and create plans to prevent cancer and control it. So our focus is on promoting health according to the needs of our communities, the types of cancers that we're seeing, the communities that have the highest burden, and then implementing evidence-based strategies to prevent and control those cancers. So our work entails systems change throughout New Hampshire, policy levers, and also environmental change. This is our recruitment flyer. So our purpose is to work across the cancer continuum. So starting from primary prevention, and early detection and screening, diagnosis and treatment, which will mainly focus on improving access to clinical trials, and then survivorship and everything that happens post-diagnosis all the way through hospice and end-of-life care. So working through that continuum to improve the lives of people living in New Hampshire, regardless of age, income, race, ethnicity, educational attainment, gender identity, sexual orientation, or geographic status, or insurance status. So everything will have a health equity lens. All of our work will have committees that span the continuum, and then we'll have different subcommittees that are more action-oriented, and that's what we'll be doing, various projects. Next slide. So this is a snapshot of cancer incidence in New Hampshire. So incidence is the number of new cancer cases per 100,000 people in New Hampshire. So you can see that breast cancer, prostate cancer, lung and bronchus, colorectal, and melanoma are the top 5 sites by incidence. Next slide. And this slide is a little blurry, sorry about that. But so this shows cancer mortality in New Hampshire. So the number of cancer deaths per 100,000 people. And you see a lot of overlap with the prior slide, lung and bronchus being the number 1 by a significant margin, and then prostate, female breast, pancreas, and colorectal. So the data really informs our activities and our work groups for the partnership. Next slide. So this is everyone, I'm sure, has seen this equity graphic in the past. So we know that when we focus on equity, everyone gets what they need, understanding their barriers, circumstances, and conditions, rather than just giving everybody the same bicycle as in the first half of the graphic above. And so we know it's crucial to focus on health equity, to reduce health disparities, and to improve health outcomes for our marginalized and underserved populations. And health equity is a critical part of our work. Next slide. This might be a little bit hard to read, but this is sort of a first draft of an organizational structure for the partnership. So I'll just walk you through it briefly at sort of a high level. We have our steering committee at the top, and they will provide overall leadership and guidance. The members are people who are really seasoned and have extensive, experience or expertise in their area. And then the committees, which go left to right, are kind of like a greenish blue color. Right underneath the steering committee. Those will align with the care continuum. So starting with primary prevention on the left and health equity. You'll notice that health equity is part of all the committee names because we do want to keep it front and center. So if primary prevention, early detection and screening, so promoting and connecting people so they can access early detection and screening tools. Diagnosis and treatment, which will mainly focus on improving access to clinical trials and improving awareness of them. And then our survivorship, quality of life, and health equity group will exist to improve quality of life for survivors and their care partners, and will include the whole care continuum from the point of diagnosis through palliative care, end-of-life care, hospice care. And then we have another group where things just didn't really fall under any other group neatly. So I'll just highlight policy and advocacy because that's one area that we will focus on there. And then all the other groups, so like the darker blue are anticipated work groups, the lighter blue are groups that are already existing because some committees, some groups have been meeting since we have not had a formal coalition in a few years, but there have still been people doing this work. So we're just connecting all of them with the Cancer Partnership so we can all be sort of on the same page and working together. Let's see, there's a general level at the bottom there for people who don't have time to come to regular meetings, but they still want to be involved in some way. They'll receive emails, maybe they'll come to our conference. We have a conference planned for tentatively June of next year. We also have this orange bidirectional arrow, which really should be an arrow like in all directions. I should put a left-right one in there too, just to show that information will flow from all levels to all levels. So it's not simply top down. Everyone will, we will have meetings where everybody's in the same room and can share feedback back and forth across the committees and subcommittees. Next slide. So this is just a sample of some of the more traditional organizations that are that have committed to joining the partnership as we're rebuilding and revitalizing our cancer partnership. So these are the traditional organizations are more of like the healthcare and public health oriented, like mostly hospitals. So you can see on this slide a few of those organizations. And then we'll move to the next slide and I'll share some of the non-traditional organizations. So these are just not strictly hospitals, they're more of our community partners and our nonprofits doing similar work so that we can leverage, really have just a true collaboration of partners. So there's some examples there. And next slide. So as we are building up our coalition, so I didn't say before, since we've just restarted, we have just had one steering committee meeting. So we're really in the very early stages of this Cancer Coalition, just rebuilding it. So as we are building up, we are seeking additional partners, in all parts of the state in a variety of settings. And we'd love to have community health workers, in our committees, because you're on the front lines working directly with families, working with our priority populations, including folks who are living in rural areas with limited access to transportation, people who are uninsured, underinsured, and insured by Medicaid. Next slide. So I wanted to come back to our cancer plan. So the New Hampshire State Cancer Plan is going to be guiding our work. So that is something that is in its very early draft phase right now. So we're going to be convening our members to talk about priorities as you see them and about any work that's being done across the state to prevent and control cancer. So this is an example of some of the work that's already started in the North Country, within the North Country AHEC. And this is with the goal of increasing awareness and completion of cancer screenings for eligible populations. So this is, by doing this, what's happening is breast and cervical cancer screening information has been integrated into the CHW training materials to connect low-income and uninsured patient populations with the available screening programs. So educating community health workers on the U.S. Preventive Services Task Force standards for early detection and screening of cancer. So this is how to talk about cancer, how to access services, knowing when to start cancer screenings and how often and for which cancers and all of that information. So that's already started with the North Country AHEC, and I know the Southern New Hampshire AHEC will be working on this next, but that is work that's already started and directly impacting the work that you do so that you can understand how to talk to people about cancer and link them to these screenings. And next slide. So we are, of course, seeking partners as we're just getting started. If you are ready to support our community in primary prevention, early detection and screening, clinical trial awareness, and survivorship work, we'd love to have your voices at the table. I can see community health workers would be really vital in any of our committees and would be great to have you, and we welcome you. So if there are any questions, I'm happy to take them. I also have my contact details there on the slide. If you think of a question afterwards, you can either email me or call me. Thank you so much for listening.
Excellent. Thank you. Are there any questions? All right. That is a no. Oh, no. Oh, Bailey's clapping. Okay. Thank you, Bailey.
Thank you, Bailey. I'll put my contact info in the chat also, just to have it there.
Perfect. Thank you. And I will also put it in my notes as well as I send out to everybody. So if they're interested, they can contact you.
Thank you.